May I now invite Dr. MEERJADY Sabrina, additional DG DGHS, to deliver her speech.
So impressed and so better to say so encouraged that I wanted to bring my career in palliative care. But what should be the role of government here? How can we work in collaboration? Actually, government will have to take main initiative, but government cannot work alone. And whatever we have done, as Professor Nizam already said, lot of things need to do further. Those who are working with the AYAT Foundation and those are colleagues abroad, Eric and others, those who have spoken here, you have contributed a lot. And on behalf of government, I really want to express our gratitude towards you people, those who have taken the initiative to build palliative care in Bangladesh. But long way to go, definitely long way to go. So far, we don't have any specific palliative care center. As Professor Nizam mentioned, a national guideline has been prepared, but that is to be implemented. We need to have a clear policy guideline, highlights of the policy document. Eric said about the training and education. We have started to do some awareness activity. We have started to do some training activities, but I also agree that it's not sufficient enough. So far, whatever we are doing, we are focusing on the healthcare workers. But to me, I think the caregivers at the family level will have to be trained also. Because in many parts, in many families, it's not possible for the family members to keep a patient or a dying patient at hospital level because of sometimes cost also. So considering all these things, and as you have mentioned in the discussion also, I think Eric mentioned about the home care issue. So if we want to encourage the home care, in that case also we need to train the family caregivers, support the caregivers to provide psychological support to the caregivers of the terminal patients. Definitely government will have to take the major initiative. We have started to work on it. It would be good if advocacy work can also be done, and arts education and organization like yours can take part in to continue that advocacy activities so that we can incorporate more issues at the at our program level. If you can come to us, because the division is going on now, if you want to include some specific activities in our operational plan, we can incorporate that, but I think it would be better if we can sit together and find out the areas where government needs to take action immediately and where government can do that in future. I would invite you, AYAT Education and also others who are involved in the palliative care activities to come forward with us so that we can sit together and find out the avenues where we can work together. And definitely, togetherness is the strength, and we need to work together. Government never can do anything alone. Palliative care, private sectors are working more than the government, but government is also interested in developing our strength, developing our capacity in providing palliative care, but that is not sufficient, as Professor Nizam also mentioned about that. I also agree with that. The palliative care issue should be incorporated in our medical education curriculum. That I do agree, and I will communicate the message. Eric mentioned about training at 3 different levels: the basic, intermediate, and the specialist one. It's very important. You have mentioned about that the public health approach is required. Definitely, just having a few hospital support or hospital beds in Dhaka Medical College and BSMU will not work. Many of the patients will be in the community level, at least at the terminal stage. So we need to create awareness on the community level also. For creating awareness, we know we have our community clinics, which is the brainchild of our Honorable Prime Minister. For creating awareness, we use that platform also. I consider myself, I'm a public health worker, so I consider myself as a member of, if I'm allowed to do some work in the field of palliative care, so I do want to consider myself as a palliative care worker also. So whenever you need any kind of support from my part, you are most welcome to contact me, and we will work together. Thank you very much for inviting me to take part. Thank you.